this video, we're going to demonstrate venipuncture collection of blood sample. So the first thing you want to do is make sure you have all the correct equipment and supplies. So you're going to need the patient's health record, provider's order and lab request, a vacuum tube, needle holder, and the proper tubes for the requested test. And you're going to need 70% alcohol prep wipes, bandage, clean gauze, and clean gloves. After you have all of the correct equipment and supplies, you want to check the provider's order and request from the test orders and make sure that you sanitize your hands and put on a pair of clean disposable gloves and an impermeable lab coat. Next thing we're going to do is we're going to verify the patient's identity using two identifiers. The person spelling his or her last name and stating their birth date. Make sure that you have the right patient. Assist the patient to sit with his or her arm well supported in a slight downward position. The purpose for this is the vein is an antecubital fasciitis and it's more easy to locate when the elbow is straight. So that's why we have the patient's arm straight. Assemble the equipment, then choose the needle size depending on your inspection of the patient's veins. So if you have a patient who's a little bit older, you might want to use a smaller needle such as a butterfly needle. So that's why you always want to inspect the patient's veins before just grabbing a standard needle. Now we're going to apply the tourniquet around the patient's arm 3 to 4 inches above the elbow. So we're going to place it right around here. And we want to make sure when we're doing this that we're not doing it too tight. Just gonna kind of like fold it under like that. The tourniquet is used to make the veins more prominent and it's easy for the radial pulse. The tourniquet has been applied too tight, then that will actually hurt the patient and make it harder for us. Ask the patient to make a fist. Clenching the fist engorges the vein, so it helps for us to get the blood. Select the venipuncture site by placing the antecubital space by using your index finger. So we're going to be able to feel the vein right here. I'm like, okay, that's a good vein. Now clean the site in the center area, working outwards in a circular motion. So now we're going to take our prep wipe and we're going to clean the area in a circular motion. It is recommended to take off the tourniquet while you're assembling your equipment and supplies. So we're going to make sure we take that off. We don't want to leave that on too long because it can't be on for more than 60 seconds. Holding the vacuum tube assemble in your dominant hand with your thumb should be the top of the finger and underneath. So you're going to want to kind of like hold it like this, and your finger, this would be like your dominant hand. So that way you're not like holding it too loosely. Place 2 fingers of the needle holder using your thumbs and push the tube in the double pointed needle, making sure that you do not change the needle's position in the vein. When the blood begins to flow into the tube, ask your patient to release the fist. So we're going to do that until we see some blood, and then they're going to ask the patient to release their fist. Allow the tube to fill up to maximum capacity. Insert the second tube if needed. So depending on how much blood the doctor is, you might need to fill up more than 1 tube. So then remove the last tube of the holder, place the gauze in the punctured site. Quickly remove the needle and engage in the safety device. So then we're going to remove the needle and we're going to discard that in the sharps container, apply pressure, and if the patient wants to, they can do that. And then we're going to put either like a cotton ball with some tape or like a bandage to make sure that the patient doesn't bleed all over. Then the next thing you want to is make sure that you apply a hyperallergenic band-aid on the area, disinfect the work area, dispose of the blood contaminated materials, the gauze, the gloves, the biohazard waste container, make sure that's all gone. And then we're going to complete the laboratory request in the routine specimen for the proper place. Record the procedure in the patient's record, and then make sure that the last and final step is you're going to date and initial the test tubes filled with blood, and you're going to make sure that you put those in the designated area because you do not want to lose those, especially because you don't want to have to take another blood draw for a patient. And thank you for watching my video and have a great day.